Hey folks, this is video 2 in my series on alternative medicine. In this video, we're going to delve into placebo effects in order to understand why alternative medicine is so alluring to so many people. We'll explore what placebo effects are, how they can be detected, and how they confuse us in our assessment of whether a treatment or intervention actually works. Among the most pioneering contributions to scientific medical progress were advancements in experimental design. How should we test treatments and interventions to give us the most reliable answers about whether they work? Statisticians Jerzy Neyman and Ronald Fisher popularized the randomized controlled trial, a study design we discussed in video 5.2 in the first half of the 20th century. And in the latter half of the century, it became the gold standard for rigorously testing proposed medical treatments, and later became pervasive in many different scientific fields. If we wish to determine whether a treatment works, we have to test it against a control that allows us to observe what would have happened in the absence of having taken the treatment, a so-called counterfactual. Now, this control is key. With many treatments that test a subjective outcome, that is, an outcome measured through self-reporting, like pain, this outcome can appear to be improved after the experiment for reasons that have nothing to do with whether or not the treatment itself has any therapeutic value. Placebos are any inert substances, often sugar pills, or inert treatments, like sham surgeries, that induce a non-therapeutic effect. They are used as controls in experiments in order to ensure that the treatment effect we're actually concerned with is not confused with a placebo effect. If we tested a treatment against a no treatment control, we could not be certain whether any effect we observed was due to a therapeutic effect from the treatment or a placebo effect. Technically speaking, the placebo effect is defined as the difference between the effects in the placebo control and the no treatment control. The difference between the treatment group and the placebo control in an experiment, thus, is the true treatment effect, assuming other assumptions are met. It should also be noted that in addition to placebo effects are so-called nonspecific effects. These include things like regression to the mean, the tendency for an extreme occurrence of something to become less extreme, shifting or regressing toward the mean. Many pain conditions lessen over time without treatment, so we need placebo controls to distinguish real effects from other effects. Nonspecific effects also include things like measurement error, which can be split up into response bias and observer bias. Response bias simply refers to inaccuracies in outcome reporting by study participants. Observer bias results from inaccuracies in assessments by the people conducting the experiment. Together with placebo effects, nonspecific effects can delude us into thinking a treatment has therapeutic value if it hasn't been tested with adequate controls. The placebo effect is often thought of as mind over matter, but this is not accurate, as there isn't good evidence your mind can create healing through belief. However, there is evidence that belief or expectations can affect our subjective perception of things, like pain or fatigue. Moreover, the placebo effect has an evil twin, the nocebo effect, which refers to negative effects due to an inert substance, or nocebo. It's interesting to note that factors like the color, size, and cost of a placebo pill or placebo treatment, as well as other properties, like its elaborateness or dramatic qualities or invasiveness, can have significant effects on the magnitude of the placebo effect. There are some common misunderstandings of what placebo effects are. The first is that placebos work. Often, proponents of alternative medicine will accept that their preferred treatments are just placebos, but that this is actually evidence they work. This is a blatant misunderstanding of what scientists and statisticians mean when they say that a treatment works. It is always in relation to an appropriate control, typically and ideally a placebo control. Relying on placebos can harm health if there are actually effective treatments out there. So this misconception can carry a price whose currency is your health. A 2012 Cochrane review found that placebos produced no major health benefits despite having a modest effect on pain. confirming similar prior findings. The second misunderstanding. Related is the advocacy that since placebos can induce a positive subjective effect, they ought to be prescribed to patients. This would violate many ethical norms that medical professionals must abide by. One is that it violates the patient-practitioner relationship because the practitioner would have to lie by misrepresenting the evidence that has invalidated a treatment against a placebo control. This, of course, violates informed consent of the patient. A second is that treatments that have been validated as working better than placebos also contain a placebo effect in addition to a therapeutic effect. In summary, without high standards of experimental design, we can easily be confused and deluded into favoring bogus treatments. This has happened with many people's embrace of alternative medicine. Understanding how we need to control for placebo effects as well as non-specific effects, we can make more informed assessments of whether treatments and interventions actually work, including dubious alternative medicine treatments. Next up, I will delve into some popular alternative medicine treatments and apply some basic principles of scientific skepticism and statistics in order to determine what the best evidence available has to say about whether they work. First up, homeopathy. Thanks for watching.